Well, a warm welcome to this talk. It's Sunday, the 9th of April, and I hope you're having a good Easter weekend. Now, a bit different tonight, something fairly easy for a Sunday I wanted to talk about, but it's something I've been meaning to do for a while. And it's about the forthcoming revolution in psychiatry with the use of new medications. Now, what brought this to mind was this from Australia. The Australians have recently had a change of mind, rescheduling of psilocybin and MDMA, that used to be called ecstasy, on the poisons standard questions and answers there, and it's got links to other sites which tell us all about what's going on with the change in regulations there and the new announcements that have been about this change to the classification of psilocybin and MDMA to enable prescribing by authorised psychiatrists. Now, this is in Australia and it's authorised psychiatrists, but this is definitely spreading, and we'll have a look at this. And we'll also probably include some reflections on psychiatry as well, because my first training was actually as a psychiatric nurse way back in the late 70s, I'm afraid. And yeah, some of the things we used to do then we wouldn't do now. Rescheduling of psilocybin. This is the Australian government, so this is the Therapeutic Goods Administration, and this really is quite a significant step for Australia. Okay, it's just particular psychiatrists, but it is going to undoubtedly spread as the efficacy of this is appreciated more and more. 3rd of Feb 2023, TGA, Therapeutic Goods Administration, permit the prescribing of MDA for the treatment of post-traumatic stress disorder, psilocybin for treatment-resistant depression, but we will be looking at other things that they can be used for. Specialised psychiatrists can do this from the 1st of July 2023. Now, Canada has been a bit ahead of the game in this. Canada, January 2022, that's the website there, that they can make special provision that allows for healthcare practitioners to request limited access to drugs that are not in authorised sale in Canada, and that includes psilocybin. Now, the history of this is really quite fascinating. Psilocybin and, well, other hallucinogenic drugs like LSD, psychedelic drugs, became well known after the Second World War, popularised in the 50s and 60s, but then they became illegal during the Vietnam era for various political reasons we won't go into. So basically what this means is for my entire career we haven't had these drugs available. They've been completely illegal, and indeed still are in the United Kingdom, and more on what we've used to do instead in a minute. But let's just notice for now, Journal of Psychiatry, treatment-resistant depression is common. It is. Maybe 25, maybe even 30% of patients don't respond to traditional antidepressant therapy. And make no mistake, you've probably had some depression. I've had levels of depression. We all know people have had depression. It's a totally wretched disease, and often with the anxiety that goes with it. And Journal of Clinical Psychiatry is saying responsible for much of the burden of major depressive disorders worldwide, because the ones you can treat are okay. If you can treat it with selective serotonin reuptake inhibitors, the Prozac type drugs, for example, all well and good, but sometimes the patients just don't respond to this. Then what are we supposed to do? Now, I'm going to give just one example here, a particularly interesting example. Research done in New York. Let me just show you the paper here, actually. I've got it. That was the Canada one. That was the legalised prescriptions in Canada. And this is the... Yeah, check that out for yourself. Pretty interesting, actually. That's from Drug Science. And this is the paper. That's difficult to treat depression. That's a Journal of Psychiatry. And here's the more detailed paper we're going to look at, albeit fairly briefly. So rapid and sustained symptom reduction. Now, the crazy thing here is when we give antidepressants, generally the patient doesn't respond or gets worse for 2 or 3 weeks, and they can take 2, 3, 4 weeks to work. Whereas the patients in this trial used psilocybin, and they got essentially instant benefit. It really is quite a fascinating possibility, really. So that's the paper. Check it out for yourself. Clinically significant anxiety and depression, they say, are common in cancer patients, of course, many of whom, unfortunately, are going to be terminal. And these psychiatric manifestations, the anxiety and depression, are associated with poor medical outcomes. And this is a double-blind, placebo-controlled trial, actually what you call a crossover trial. They crossed it over with psilocybin and vitamin B3, which sometimes is used with psilocybin, actually. So the intervention, and this is the amazing bit. There was a single dose of psilocybin, 0.3 milligrams per kilogram. So for a 70 kilogram individual, that would be 21 milligrams of psilocybin. Now, psilocybin is originally found from cubensis mushrooms, what are sometimes called magic mushrooms. So the equivalent dose in dried mushroom for most species for there would be about 2 grams. So that's the same as saying about 2 grams of dried mushroom, magic mushroom. Never pick any mushrooms you find. Do not take any form of drugs that aren't legally prescribed by your doctor under any circumstances, and certainly not on the basis of what I say. This is for educational purposes only. Seriously, you can pick the wrong ones and they can kill you. This is a field for expert scientists. Now, they gave this trial here, the New York one, they gave it in combination with psychotherapy. So it was like psychedelic assisted psychotherapy. There's a bit of a debate around that. I'll come to that in a minute. Psilocybin produced immediate, substantial and sustained improvement in anxiety and depression, clearly stated in the paper. Wonderful. Led to decreases in cancer-related demoralization and hopelessness. This is one of the things about depression. It's the feeling of hopelessness. This is why people kill themselves. People kill themselves not because they're having a bad patch, but because there is no hope. This is part of the depression. They really believe there is no hope. There is, of course, there's always hope. And depression is eminently treatable in many circumstances. This is part of it. You feel the situation is hopeless. That's why people take their own lives. Terrible. The balance of the mind is disturbed. So this feeling of hopelessness is relieved by this. Improved spiritual well-being and increased quality of life. Really quite incredible. And this, remember, is after one dose accompanied by psychotherapy. How long did this last for? Well, 6.5-month follow-up. Psilocybin was associated with enduring anxiolytic. That means lytic is to break up, isn't it? So anxiety breaking up, anxiety reducing. And antidepressant effects. 60 to 80% of participants continue with clinically significant reductions in depression or anxiety. And that's without small top-up doses. Sustained benefit in existential distress and quality of life. Incredible. As well as improved attitudes towards death. Now, this is the bit that's interesting. The authors of the paper say this: the psilocybin-induced mystical experience mediated the therapeutic effect of psilocybin on anxiety and depression. I don't think they've got the evidence to say that. So they're saying that you take this drug and you have this experience, this psychedelic experience in these trial conditions. And that combined with the psychotherapy is that experience which is mediating the therapeutic effect. But I don't think they have the evidence to say that. It could well be that it's purely a chemical effect on the brain that's mediating the benefit. So if you give a tenth of this active psychedelic dose as a microdose, you're not going to get any of the psychedelic effects. You're not going to have any strange experiences. But over time, other papers that I'm not going to go into today, but they do show benefit from that. So I strongly suspect that it's not the experience per se that's bringing about the benefit. Because depression is a disorder of the mind in some way. Okay, it's not caused by the simple serotonin models we thought it was, but it's that there is a physiological stroke biochemical adverse something wrong in the brain that affects the mind. I think that's probably the basis of depression. And I suspect that this drug, this psilocybin, can alter that without the hallucinogenic or the psychedelic, at least, effects. So more work needs to be done on that. If this were the case, if I'm correct, and then we could give a dose of, say, well, what were they given? They were given 21 milligrams. Suppose you could give a dose of 1 milligram or 2 milligrams of psilocybin. This wouldn't have a hallucinogenic effect, and yet over time may have a dramatic therapeutic effect. If so, that could well be an incredibly safe treatment for depression, if the regulatory authorities around the world get their act together. So changes to looking back at the Australian data, changes to the classification of psilocybin and MDMA to enable prescribing by authorised psychiatrists. Now, I'd hope that pretty soon the first group of doctors to extend this to would be terminal care physicians or oncologists looking after cancer patients. After that, you would expect it to be extended to general practitioners. And after that, you would expect it to be extended to appropriately trained psychotherapists who are not necessarily medically trained, although at the moment this is given all under medical supervision. As a psychiatric nurse, I think I would... I haven't practiced psychiatry for a long time. Well, not full time. Obviously, psychiatry comes into everything. But I would expect to be able to manage a patient in this situation really quite readily. I don't think it would present too much of a challenge for most psychiatric nurses to do that. And of course, if someone is having what might be called a bad trip, you can bring them down with benzodiazepines or antipsychotics, of course. In this study, the New York study, that wasn't needed for anyone. There was no significant adverse effects at all, and no one needed to be de-escalated, as it were, from the experience. Anyway, back to the TGA in Australia. Medicines containing psychedelic substances, psilocybin, and methyl-L-N-doxy-methamphetamine. Methyl-L-N-doxy-methamphetamine with a 3-4 in front. That's the name. That's what used to be called the ecstasy molecule, particularly appropriate for post-traumatic stress disorder. Now, like me, you'll have known people with post-traumatic stress disorder, and I've worked professionally with people with post-traumatic stress disorder. Appalling, debilitating condition. If this drug can treat these people, treat this suffering, then I think we have to be open to using these sorts of treatments under appropriate supervision. Only conditions with current evidence. Now, this is the Australian authorities. They're saying that the only place there's current evidence is for potential benefits in certain patients. So they're not saying it's for everyone. So the MDMA for the treatment of traumatic stress disorder, psilocybin for treatment-resistant depression. Now, I've certainly got experience of people I've known who've had incredible positive results from psilocybin with addiction, reducing addiction, and many other things. There's potential evidence for, but of course we can't do that at the moment because it's illegal in the United Kingdom. So we just have to carry on suffering until this becomes legal. Patients may be vulnerable during the psychedelic-assisted psychotherapy, the Australians are saying. So requiring appropriate measures, which is why only particular psychiatrists can prescribe it to begin with. But as I say, I'm very hopeful, and what we need to see trials of is the microdosing, where you don't get this psychedelic effect. I don't fancy a psychedelic effect, I must say, but to feel a bit better with legal psilocybin would be an interesting possibility for many of us, I think, who are not as relaxed and basically a lot of us have got a level of anxiety and depression. I have, and many of you watching have, if you're honest, and we know many people in our families and friendship groups who have unwanted anxiety and depression. If microdosing could treat that, then that would be an interesting possibility. Now, they do say that you can't get this in Australia at the moment. There are no currently approved products, but they reckon that they can fix that. This amendment will allow authorised psychiatrists to access and legally supplied and specific unapproved medicines. So I expect that to come up now. In the UK, this is happening. Now, this is a group I've been following for a while, Small Pharma. Note small pharma, not big pharma. I like it. I have no commercial interest in this, I hasten to add. Everyone deserves the option of a better mental health. We're on a mission to fast-track the development of short-duration psychedelic therapies for patients affected by depression and other mental conditions. So, as I understand it, this group is aiming for legal authorization of their preparations fairly soon. And there are people growing, cultivating psilocybin mushrooms completely legally under license that can be used in clinical trials and in time can potentially be legalized. Now, as I was saying, I was a student psychiatric nurse in the late 70s. By that time, these psychedelics were illegal after the Vietnam era. And now, coming towards the end of my career, it looks like they're coming back in. So we've basically missed out on 50 years. And during that time, I've seen people die of cancer in extreme distress, die from other conditions in extreme distress. Could it be that they could have been treated with these preparations, which were made illegal largely arguably for political reasons? When I started as a psychiatric nurse, every weekday we'd do about half a dozen electroconvulsive therapies. So the patient would come in, they'd lie down, the anaesthetist would put a line in their arm, they'd be given a general anaesthetic, injectable thiopentone sodium in those days. They'd be given a drug to dry up the secretion, atropine. Then they'd be given a drug called succinylmethonium chloride that blocked all the neuromuscular junctions, and they were completely paralysed. They had to be ventilated. Mouth gag would go in, 110 volts would go straight through the brain, and even on the succinylmethonium chloride, where they're completely paralysed, they'd still fit, and you would see the shaking of the convulsion. The idea that we did that for all those years when there was a reasonable alternative for drug-resistant depression is an uncomfortable feeling. And the most uncomfortable feeling I'm left with after those years really is we thought this was normal. We thought that electrocuting people's brains was normal at the time. So interesting. Canada, fair degree of allowed under special circumstances. Australia, again, specialist psychiatrists initially, but that's the way I'll start. And of course, these specialist psychiatrists that start giving this, they'll be able to collect really good quality data. And I'm convinced it will show efficacy, and I suspect at the non-psychedelic dose. So it looks like we're missing a bit of a trick at the moment. Now, there's another mushroom that I've grown myself. Here it is here. I think I can maybe show you it. I actually grew some of this last summer. Yeah, there we go. That's it there. This is called lion's mane. And obviously it looks like a lion's mane. And there's evidence, at least in mice, that this promotes peripheral nerve growth after peripheral nerve damage. Now, it looks a bit strange, but it's solid inside. And it actually tastes really nice. I just grew a few of these things and I sliced it up and I fried it in a little bit of butter. It was absolutely delicious. I was going to grow up a big batch of it with the because all you do grow it on is hardwood sawdust and wheat bran. But I was busy, I never got around to it. But that was it. So very, very, very tasty mushroom. Probably supports nerve regeneration, nerve fibre regeneration, and again, really have to wonder why this is not being picked up by big pharma. Maybe small pharma will pick that up. So this one's 100% legal, of course. Very common in Chinese cuisine. If you look in Chinese supermarkets, you can sometimes find the dried version. Not as tasty as the fresh, of course. So lots of potential there, but that's the immediate one. So I just thought that was an interesting, easy story. I hope you found that interesting to listen to. And yeah, interesting to reflect. Check on the references. Lots of stuff on this now. There's some very good Netflix videos on new use of mushrooms, and lots of interest coming into this now. And I'm convinced this is going to be a revolution in psychiatry, and this potentially, if other things like this take off, in neurology as well. Interesting. Big pharmaceutical industry is probably not going to be interested in the clinical trials because I don't think you can patent mushrooms. But I think the evidence of efficacy, as it accumulates, could well become overwhelming. We'll leave it there. Thank you for watching.